please subscribe and don't forget to press the bell icon to get notified whenever we upload a new video.
Diabetes is fast gaining the status of a potential epidemic, with as many as 69 million people in India living with this killer disease. Even then, the awareness well with diabetes. This series puts the spotlight on the causes, symptoms, prevalence and management of diabetes. Today we are coming to you from the financial capital Mumbai, and our topic of discussion is diabetes in children. Let's welcome our set of experts for the day. Dr. Shailesh Lodha, Senior Consultant and in charge, Department of Diabetes and Endocrine Sciences, Eternal Hospital, Jaipur. Dr. Sachin Chitawar, Assistant Professor Medicine, Gandhi Medical College, Bhopal. And Dr. Amey Joshi, Consultant Endocrinologist, Bhakti Vedanta Hospital and Research Institute, Mumbai. Welcome, gentlemen. Thank you so much for joining us on the show today. Dr. Lodha, let me begin by asking you, what's the difference in diabetes in an adult and a child, and how prevalent is diabetes in children today?
Actually, diabetes in children is fortunately very less as compared to what it is in adults. About in India, roughly only 5% of the total diabetic population, 5 to 7% is type 1 diabetes or diabetes in children.
Right.
And unlike in type 2, where it is usually silent or produce very little symptoms, in children it is almost like a bolt from the blue for the family and for the child. They start losing weight, become lethargic, lot of urine, they drink a lot, take a lot of food. So that is how it is clearly visible.
Right. But how would you differentiate in diabetes in a child and an adult?
Yeah, pathologically there is insulin deficiency, absolute insulin deficiency. That means the insulin producing cells in the beta cells in the pancreas, they are almost gone. Right. Because of some autoimmune process, they suddenly start dying. And as a result, there is no insulin production, and so these children, they present with very high levels of glucose or sometimes ketones, and that is how they are picked up.
Right. All right. And Dr. Sachin, what are the common signs and symptoms? He did speak of some. What are the common signs and symptoms of diabetes in children? Is it largely asymptomatic or not? And what are the probable reasons for diabetes in children?
Yeah, it's a very pertinent question. Right now, we are dealing with a situation where it can be occurred sometimes. Most of the times, out of 3 cases which are diagnosed as type 1 diabetes in India, 2 of them, they land up in ICU settings. And then we know that they have high sugar levels and they are actually undergoing a very threatening illness like diabetic ketoacidosis. So excessive hunger, excessive thirst, if the child is losing weight, he's losing interest in studies, and somehow, somewhere, the parent should be alarmed that they are dealing with something like type 1 diabetes.
Right.
So if someone is like this, if someone is losing weight, then we should actually give importance to those symptoms, and then it can be diagnosed.
Right. And again, Dr. Joshi, would you like to add on to that on the diagnosis front, as well as once the diagnosis has happened, what's the next step?
As Dr. Sachin and Dr. Lodha sir said, type 1 diabetes presents as a catastrophe. So a child presenting in an ICU with a very high glucose level, the diagnosis is clear. We see nowadays obese children, children of parents who have strong family history of diabetes, presenting with type 2 diabetes, which is a hidden disease. And so what we need to do is screen these obese children. There are no definite screening guidelines, but what qualifies as a diabetes cutoff in adult applies to children also. So a child presenting at random with the above symptoms and a glucose level more than 200 is classified as diabetes.
Right. So that's as far as diagnosis is concerned, but what are the treatment options available for children, and does a child have to get onto medicines immediately?
If it is type 1, first we clinically decide whether this is type 1 or 2. And if it is not possible in some situation, we can do some tests like GAD65 antibodies or serum insulin C-peptide. And once we are sure that this is type 1, then we start the treatment, which is insulin. And it should be clear to everyone that for type 1 diabetes, the only treatment available anywhere in the world is insulin.
Right. So, Dr. Sachin, how often does a child have to take insulin shots, and going forward over the years, can the dosage come down, or is it constant, or how does that work?
It depends on the sugar profile of the patient. If the sugar profile is like this, it is well controlled with 2 shots, then we are very much comfortable in giving them 2 shots. Yeah, there are children who require 3, there are children who require 4 shots. We call basal bolus therapy. With every meal, definitely the moment you will eat something, there will be rise in sugars. So you'll have to cover it. That is only possible when we give shorter acting insulins before breakfast, before lunch and before dinner. And we give a basal longer acting insulin in the night. But there are some other options available nowadays. We are putting up pumps also. So for those kids who are not having very tight control of sugars and they want to have more leverage with respect to, more freedom with respect to injecting those shots, we prescribe them pumps also. So the options are coming up and we need to rationalize it. Not just giving the shot is important, how to give the shot, where to keep the insulin. And these are the issues which come under diabetic education. That is more important for a diabetic. Before giving a shot, they should be aware of these kind of things, and actually they are the parents who should know about it.
Absolutely. All right, so let's take a short break at this point. After the break, our panel of experts will tell us all that parents and teachers can do to support children who are living with diabetes. On today's episode, we're discussing the prevalence of diabetes in children. Let's talk now about the role that lifestyle habits can play in managing diabetes in children. Dr. Joshi, one question that perhaps all parents have is my child going to have a normal childhood? Is the growth going to be impacted at all?
So, I mean, this is something that has been very close to my heart. I have also published a paper on this. What is important is that a poorer the child is controlled, the more the child's growth lags behind. So not only for every diabetic child, for every child he must have a growth chart which should be filled at every visit to a health care provider. In diabetics, there is association of more of gluten sensitivity, hypothyroidism, and even poor glycemic control, which is hindering the growth of the child, not only growth but also the pubertal development. It is important at every visit of a diabetic child to a healthcare provider, these aspects are paid attention to, and there are well-defined tools like growth charts which can be used even at a home, school, or obviously in a clinical setting to know the growth of the child.
Right. Would you like to add on to that, Dr. Sachin? Is the growth of a child impacted first? And secondly, your advice to children to manage diabetes at school, maybe advice to children as well as their teachers?
Firstly, you should make it very clear the targets for sugars. It has to be around 100 fasting. It has to be less than 180 for postprandial blood sugars. And the HbA1c, which we discussed last time, it was somewhere around about 7% or to 7.5%. Previously, the targets were relaxed for kids. Now they have made it around 7.5%. Secondly, impaction of growth. Definitely it is impacted. You need to worry about the puberty. You need to worry about, if it is a girl child, you need to worry about her growth as a girl and onset of periods, menarche. And for the boy, again, you should be concerned about the hair growth, again, the change of voice and puberty. Such kind of things will not come up if the sugars are not good. Apart from that, there are issues like celiac disease, which he has talked about, that is gluten sensitivity. That also is something which accompanies type 1 diabetes sometimes. And since it is an autoimmune illness, hypothyroidism has also to be taken care of. And how does it impact a family? Definitely, nowadays we do have 1 or 2 kids, and parents are very much concerned about, they want everything should be perfect and they want it in this way only. So if the child is like that, if the child is not growing, there is a kind of peer pressure also, parental pressure also, and from the society also the feedback keeps on coming regularly to the patient. So there are a lot of social issues involved with it. So we need to be very particular, and first and the foremost is you need to keep the sugars normal, and the diabetic education part, and the parents should be well versed and well taught, and they should be confident about the things which they are doing for their kid. So this is something parents should be well versed and well taught, and they should be confident about the things which they are doing for their kid. So this is something in toto can bring up a good sugar control in type 1 diabetes.
Right. And what's your advice to teachers? How do they manage their students who are
first and the foremost, thing for a teacher is that she should be or he should be aware of type 1 diabetes. This is not a routine type 2 diabetes. This is not a routine illness. This is an illness which is actually making that particular child to inject insulin twice, thrice or 4 times in a day.
Right.
And there are issues relating to hypoglycemia. They should be aware of it. Any moment, a particular point of time, the child feels extreme hunger, thirst, palpitation, tremors, or he's getting unconscious.
Right.
The teacher should be aware about the symptoms and signs of hypoglycemia and how to manage it out. Because that particular 15-gram sugar, that approach has to be there. There has to be an availability of a toffee or something like biscuits or some liquid drink which can give this amount of sugar to the child. That is to be there. And if a child wants to eat in between the class, if he is feeling hungry, she is feeling hungry, they should be allowed because they are a special child.
Right.
And the discrimination part, the peer discrimination should not be there. There has to be, again, they should be given a special treatment, but they should not feel it.
Right.
This is something which is required.
Right. So a lot more compassion required towards these children. Dr. Lodha, what's your advice to parents? How should they support their children through type 1 diabetes, and especially when it comes to lifestyle habits or diet? For instance, it's very difficult to tell a child that you cannot eat cake at a birthday party.
Yes.
So how do parents deal with such children?
Actually, the whole family has to be together. There are subtle ways by which the family can bring the child and his development up together without realizing the child that he is deprived of a lot of eatables or sweets or other good things in the life.
Right.
So the feeling of the parents with the child should be that nothing is banned for this child. He can eat anything, he can enjoy all the pleasures of the life, and diabetes is not going to be a hurdle in the development of the child, in the career of the child.
Right.
Because we have many examples like this, and commonly we all quote Wasim Akram, a pace bowler with type 1 diabetes, where you require extreme strength. So the child should understand that there is no hurdle in life for the progress or for career.
Right.
Similarly, for lifestyle modifications, again the whole family has to do. Parents or elder sibs, they should accompany the child for playing or for walking or for exercises, going to the gym.
Right.
Similarly, for when they are dining together, then everybody should eat almost the same thing.
Right.
Because as such, that food for a diabetic is the best food for everyone, whether the patient or the family is diabetic or not.
Yeah.
Food for type 1 diabetic or for food for any diabetic is good for everyone.
Correct.
So there is nothing wrong if people who are
No
not
harm in
suffering
eating
for
less
diabetes,
sugar.
even if they leave the sugar. Actually, we don't need sugar throughout our life.
Right.
And the parents and the society should also understand that sugar is not required by the body throughout our life from birth to death.
Right. All right. That's an interesting point that you've made for our viewers. But also, how important is exercise for a child dealing with diabetes?
Yeah, exercise is extremely important. It is one of the important pillars in the management of diabetes. Exercise, food management, and then comes the insulin. Insulin success is totally dependent on physical activity and food management.
Right.
Insulin is just supporting. Whatever amount of insulin you are pumping, but if the child is not careful or the family is not careful with physical activity and with carb intake, then the whole insulin treatment may not be fruitful.
Right.
So exercise, it may be in any form, whatever suits the family, whatever suits the child. It can be walking, it can be yoga, it can be going to the gym, it can be just skipping or doing physical activities, aerobics at home also.
Right. Sweating it out is important, basically. All right. And Dr. Joshi, where children are involved, there are also emotional issues of the child to deal with. So what's your suggestion to parents, how to go about that? There is a social stigma attached to taking shots publicly in school in front of friends. So how do you deal with the mental psychology of a child?
See, diabetes gives a different label to the child with which he has to adjust with the society, which has to be facilitated by his parents. And that's why we see a lot of psychological issues. A psychiatrist and a psychologist is an essential part of a caregiver team. We see denial, we see embarrassment, we see isolation as well as guilt. Right. And the parent can facilitate this the most. The first thing when I see a type 1 diabetic coming to my clinic cribbing about insulin, what I do is I take the needle, I prick myself. I may or may not take the insulin, but I prick myself. The second prick I give is the third moment the child becomes much more comfortable. I would like to reiterate that we learn from great men, and I was brought up in Pavanar Ashram, so I always say, be the change you want to see in your child. If, as sir said, if the family follows proper diet, the child automatically knows.
Right.
If the father tells that this is green, you can have it in abundance, this is yellow, you can have it in moderation, this is red, you have to limit this. You may like it, but have it the last. Have simple food, first good, last bad. A society cannot contribute in a big way. South African government is planning to impose tax on sugary beverages and junk food from April. I think that was a movement led by the Endocrine Society of South Africa, and I think others should follow the same example. So as a child, as a parent, and as a society, we should come together to see that these grow well.
All right, that's very well said. As we close, I'm going to ask each of you doctors for your take-home message to children who are dealing with diabetes. How should they live well with diabetes? Maybe children, parents, teachers, your message for all of them. Dr. Lodha.
Don't be afraid of diabetes, and diabetes is not a taboo. Grow well with diabetes, live well with diabetes. Don't miss your insulin. Once you are prescribed insulin, take insulin. If you take insulin properly, nothing can stop you.
Right. All right. Dr. Sachin?
Type 1 diabetes is not a dreaded disease. It is something which can be managed like playing cricket. You need to go as per your run rate. That is, your fasting sugar should be around 100. Postprandial sugar should be less than 180. And HbA1c, that is glycated hemoglobin, should be somewhere around about 7.5%. And you should not worry about anything else. And none of the, even your parents, even your friends, even the peers, they should not keep on pointing out towards your illness. The environment should be friendly and healthier, and one should try to have such kind of environment in his life. And again, the type 1 diabetes patient is as normal as a normal human being.
All right. Dr. Joshi?
I think you should learn here from Srimad Bhagavad Gita. You have two ways. When Arjuna was faced with a problem, or a child which is diagnosed with diabetes, he has to either perform and win, or the things could be bad. And the correct role of a correct guide or a sarathi has to be played by a doctor, parent, and the teacher. Right. If this harmony, which is there with us since years, thousands of years, is again replicated in this model, I think the situation is going to be win and win.
All right. Thank you very much, doctors. Thank you for sharing all of those valuable insights with us today. With that, it's a wrap of this episode of Live Well with Diabetes. Remember, a positive mindset, diet control, and regular exercise can go a long way in helping your child live well with diabetes. Hope the insights helped you. We'll be back with lots more next time. Till then, thanks for joining us. Goodbye.